My name is Emily Hulse. I'm a research associate at the lovely Government Outcomes Lab, and I'll be taking you through our latest evaluation report, which I think has relevancy for anyone working or interested in social impact bonds, social outcome contracts, and employment support programs, particularly targeting those with mental health and/or disabilities. And here is a photo of our lovely report with the QR code. And don't worry, the QR code, if you can't grab it in time, it will be on later slides for your reading purposes. Next slide, please. Perfect, acknowledgements. Next slide, thanks, Sri. Perfect. Now, the structure of today, I'm aiming to summarize the key findings, our first report of the GoLab evaluation of the Mental Health Employment Partnership, which is commissioned under the Life Chances Fund. So I'll be going through, introduction, methods, findings, and conclusion. Now, on our next slide, and the next slide, I'll jump into more of the introduction of MHEP. So as Sarah said, the Mental Health and Employment Partnership, or MHEP, was established in 2015 to drive the expansion of high quality employment support intervention, which is known as individual placement and support, or IPS. So there are 5 social impact bonds that are contracted under the Life Chances Fund through this MHEP project. And these are Haringey Barnet, Shropshire, Enfield, Tower Hamlets for the mental health cohort, and Tower Hamlets for the learning disability cohort. Now, on our next slide, just to recap the sort of service that's within these social impact bonds. So IPS as the intervention, it involves integrating employment specialists within health teams to optimize return to work. So the MHEP projects support people experiencing mental health issues and learning disabilities, or all in learning disabilities, to find and remain in competitive and paid work. So IPS services are quite unique that they do not exclude people on the basis of diagnosis, symptoms, or substance misuse on these key principles, which are zero exclusion, unlimited support, and integrated services. Now, on our next slide, in terms of the social impact bonds, as Sarah kindly said, MHEP is a special purpose vehicle which is run by social finance. So what does this mean? It's a legal entity which is created solely for a financial transaction or to fulfill a specific contractual objective. And as many of us know, special purpose vehicles are sometimes used to structure impact bonds. So in terms of the 5 social impact bonds within MHEP, these all meet the definition of an impact bond used by Indigo, or the International Network for Data on Impact and Government Outcomes. So what is this definition of an impact bond? Basically, if anyone that doesn't know, it's a contractual relationship that includes 2 core factors. So the first is a payment for outcomes achieved, so aka an outcome contract. And the second core factor is upfront repayable finance provided by a third party, of which the repayment is partially or fully conditional on this achievement of the outcomes. Now, in the next slide, we'll talk about the outcomes that are tied to payment in the MHEP social impact bonds. So there are 3 pre-specified measurable outcomes that are tied to payment in these impact bonds. So the first one is engagement. So this is the individual or client users that engage with the IPS services, and they complete a vocational profile of aspirations of paid work, of previous paid work, etc. The second is job starts, so that the individual spends 1 full day or 4 hours of part-time work in paid competitive employment. And thirdly, job sustainment. So an individual sustains paid competitive employment for at least 13 weeks. Now, on the next slide, we can see these 5 social impact bonds and the cohorts. So as Sarah said, 4 of them are targeting people with serious mental illness, while the last one is targeting learning disabilities. And we can also see the service delivery dates, all of them starting quite close to COVID. And we will talk about that later in the presentation. You can also see the separate providers, and we're really fortunate to have a provider voice on the panel for our second part today, Oliver from Twining Enterprise. And also in the later section of the table, we can see these targets that have been set for these 3 payable outcomes, as well as referral, which is just a handy thing to have for performance. Now, on the next slide, I would just want to quickly talk about the actors of social impact bonds, because sometimes it can be quite confusing for a sort of an external to understand who's who is doing what, etc. So firstly, we have social finance. It is a co-commissioner. It functions as an intermediary. It manages the performance and the contract, and it also houses this special purpose vehicle. Secondly, we have Big Issue Invest. So Big Issue Invest is the investor or the investment fund manager. So what does this mean? They provide the upfront social investment, which is channeled through MHEP, which is the working capital or the setup capital for these impact bonds. Next, we have the providers, which deliver the service or deliver IPS. So these are Enable, Working Well Trust, Twining Enterprise, and JET. Next, we have the local commissioners. So what do local commissioners do in this situation? Well, they provide the majority of outcome payments if the outcomes are achieved. And we also have Life Chances Fund. So Life Chances Fund provides a minority contribution to outcome payments. So they are indeed co-payers of outcomes, but in fact, the outcome contracts themselves are housed at the local level. What is interesting is that the MHEP project is required to provide regular updates on the progress to the Life Chances Fund, which includes quarterly, annual, and end of award monitoring through the Life Chances Fund data platform. Now, the next slide just briefly touches on the structure of the MHEP projects, which is definitely included in the report. So if you are interested on more of the structure and the design, feel free to have a read. Now, on the next slide, I want to talk about the methods. And on the next slide, there is a question. So this report is the first of 3 planned reports, which we're super fortunate to have this opportunity for deeper analysis. So it is a longitudinal evaluation, and it uses a mixed methods approach. So overall question is, did the MHEP social impact bonds, specifically the outcome contracts and or the performance management function, make a difference to the outcomes achieved compared to alternative commissioning approaches? And so what mechanisms do the social impact bonds do, and how is this contributing to improved impacts if that is the case? And also, do the benefits of a SIB or using a SIB outweigh the costs? So this is what we're really trying to nail down with this evaluation. And we're super fortunate to have Eleanor Carter, our research director at GoLab, who will also be on the panel. So if you have any more questions about this evaluation strategy, feel free to ask her some questions. Now on the next slide, so why are we evaluating MHEP? What is so special about the MHEP case study? So MHEP is being evaluated as part of our supplementary evaluation, or the LCF supplementary evaluation, sorry, which involves a deep dive or in-depth studies into certain projects, which look to directly compare the use of SIBs to alternative commissioning mechanisms. So MHEP provides a useful project for this because, number one, it delivers a tightly defined intervention, IPS, and it also has been delivered through other commissioning models in the NHS. So through this approach, we really can assess the extent to which the social impact bonds is contributing to outcomes achieved. So on the next slide, this is just sort of the summary of what I'm talking about, of why MHEP is unique and why it's an optimal evaluation site. Firstly, it delivers this international established evidence-based intervention IPS. As we've said before, it has a well-defined validated fidelity scale, which is an extremely handy analytical tool for us. And IPS has been subject to national and international research on showing the effectiveness of it compared to other sort of vocational programs. And this differs to other social impact bonds, which are testing new interventions. So this provides a slightly advantageous sort of element. The second point is that it has an existing live comparator. So IPS is being delivered through non-social impact bond contracts. So traditional commissioned IPS. And this is being in 350 sites across the UK due to the national commitment to scale up IPS in the NHS through the long-term plan. And we also have Julia from IPS Grow here, who is willing and happy to talk about the scale up of IPS. And this differs to other social impact bonds, which lack a robust counterfactual and lack a live comparator site. So we're super fortunate. And the last point is that MHEP is a large social impact bond project and it has a high number of project participants. So as Sarah said, over 10,000 people since 2015, since the conception, have been going through these services. And this compares to other LCF projects which are slightly more small and other social impact bond projects internationally, which are slightly more pilots or a bit more smaller scale. So in terms of the next slide, thanks, Sri. So phase 1 is the analysis of the preliminary performance of these social impact bonds. It talks about the distinctive contribution of MHEP as a co-commissioner and how that differs to traditional commissioners. And it also finally talks about the facilitators and barriers in terms of the external influences on implementing social impact bonds, as well as the theory of change of how MHEP is interacting with all its stakeholders. And as I said before, it is a first of many reports. So we have phase 2 and phase 3 reports. So currently we are on the way to writing and completing these as well. So stay tuned. And in our next slide, I will jump straight into the methods of this report. Thank you. So as I said, generating theories of change, exploring the distinct contribution of MHEP, and analyzing the performance of key outcome metrics through time and across different sites and providers. So these are our 3 aims. Now on our next slide, this is our report. We are super excited. It was recently published in March this year. Feel free to put your phone over the QR code. This links to the UK government website, which has not only executive summary of 2 pages, very quick, easy read, as well as a juicy report, as Andrea said. So definitely some Sunday reading. Now, in terms of what is in this report, we have included analysis and collection through documentary analysis, through board reports, and through the LCF data platform. We've also included 3 theory of change workshops, with each stakeholder. So this is the commissioners, this is the providers, and this is social finance that are involved in this project. We've also included 22 interviews with all of these stakeholders in the report, as well as the midterm performance analysis, which is from the start of the social impact bonds to the end of 2021. Now, in terms of the next slide, we can see the range of qualitative collection. We have done quite a comprehensive sort of sweep of qualitative sort of collection methods. You know, we've done the interviews, we've done observations, we've done a theory of change workshops, and we've done a couple of observations as well, just to give a bit more color and really get into the understanding of what are the MHEP social impact bonds doing compared to other alternative commissioning approaches. And on the next slide, we can see the distribution of interviewees. You know, we have 22 total interviews, but this is really quite evenly spread across the service providers that we have, the commissioners, as well as the MHEP teams, TNLCF, and the investor through Big Issue Invest. Now on the next slide, we can see the quantitative component. So we have collated and merged primary and secondary data from multiple sources and created a single main data set. You know, we've extracted project performance from social finance, the DCMS data portal. We've also collected the Oxford COVID-19 government tracker. And we've also collected IPS effectiveness data from the literature to see how MHEP SIBs are compared to sort of other SIB performance, other IPS performances, apologies. In terms of the analysis, this was mainly through descriptive project level outcome analysis, and this is through the time and across the different SIB projects within the within MHEP. And also to measure performance, we didn't just want to look at the outcome achievement. We want to have a bit more of a wider success. So we developed 2 metrics to capture this success beyond just simple outcome counts. So what are these? These are success rate, and this is conversion rate. So success rate is the ratio of the number of outcomes that were achieved by the number of targets that were set initially. And then the outcome conversion rate is the rate that one type of outcome converts into another that follows it. So for example, engagement to job starts or job starts to sustainment. So this is a standardized metric, and job outcome rate is widely used in measuring the effectiveness of IPS. Now, in the next slide, we'll jump straight into the results. So firstly, we have our theory of change. Our theory of change connects inputs to eventual outcomes, and it also unpacks mechanisms which help MHEP transform its inputs into both short-term and long-term outcomes. So this figure summarizes the theory of change that was agreed and shared by all three stakeholder groups. So this is the local commissioners, this is the providers, and this is the MHEP. So we can see through the bold here that the MHEP provides inputs of support through convening and advocacy, analytical inputs and support, and operational input and support. And this leads to mechanisms of change or mediating mechanisms, which is additional financial and human resources, collaborative way of working, and additional performance management. And so on a next slide, we'll jump straight into kind of what does this mean? So there were diverse views on whether MHEP was distinctive over traditional commissioning. But across all of these stakeholders, they managed to agree on three functions. As I said before, additional financial and human resources that the SIB was providing compared to working with local authorities, so non-SIB approaches. The second thing that was distinct was a more collaborative way of working. And thirdly, this additional performance management, which is not something that is quite a new finding. You know, we know that additional performance management has been sort of found or revealed in other social impact bond projects. So in terms of the next slide, I'll go just slightly more into this. So additional financial and human resources, what does this mean? So MHEP provided access to social impact bond and life chance fund funding, which IPS providers would not have been able to receive otherwise without this social impact bond. So this meant that it was able to boost local capacity and enable additional employment specialists to be hired. So one provider revealed to me that 2 employment specialists were able to be hired due to this additional funding that was provided through the social impact bond, which meant an abundance of extra service users that they could of service and help improve their well-being and their lifestyle and their get access to paid competitive employment. The second one is collaborative way of working. So MHEP was described as a three-way partnership. It was described as a relational approach. It was described as increasing accountability. But what underpinned this was shared purpose and shared values, which is something that a lot of us truly kind of understand. And even though that this collaborative way of working through the social impact bond was considerable work, according to our interviewees, where there was an initial setup in terms of trust building and showing, what is MHEP doing in terms of performance management and how is it different to traditional commissioners. However, despite this initial work, it was viewed as hugely beneficial. And lastly, with the additional performance management, what do we mean? So MHEP provided a dedicated performance management function, and this was seen to drive an additional focus on achieving outcomes. So this took the form of regular and rigorous scrutiny through the MHEP team as part of the social impact bond contract, which was on top of the provider's internal processes. So this was grounded in more analytical capacity and data, and particularly granular data and benchmarking. However, there were some concern about heightened reporting requirements, and this was described as from interviewees as layers of reporting, in which they had to report to MHEP, to their commissioner, to the mental health employment service data set, NHS England spreadsheets. So there was quite a bit of reporting. However, we know and we understand now that that has actually reduced over time. Now, the next slide, I think, is probably the most interesting to me is MHEP distinctive compared to traditional commissioning? Yes, no, let's get into it. So firstly, in terms of yes, it is distinctive, I'll go on to the positive distinctions. So data analytics intelligence and performance management seen to drive additional focus compared to working with local authorities. Secondly, the working culture was very effective compared to local authorities. And interviewees described that working with local authorities were a little bit more paternalistic than MHEP, and while MHEP was a bit more peer-to-peer. And lastly, the positive distinction is that MHEP identified LCF funding opportunities which add financial resources to these projects, which help them have a bit more of a sustainable perspective and not struggle on sort of year-to-year contracts. However, in terms of the negative distinctions, due to the different backgrounds, MHEP approach was considered a little bit theoretical by some interviewees. They found that sometimes it was removed from the practicalities of local IPS delivery. And this was often due to the use of different technical language and jargon. In terms of no, there isn't a distinction. What we found is that some interviewees found that it wasn't marketably additional to existing practices in performance management within local authorities, but GoLab is currently looking into whether or not that the people that said that there was no distinction, whether or not they just had slightly better baseline performance management. Now, in terms of the next slide, in terms of the common facilitators and barriers, the common facilitator among all was that there was an alignment of these contracts with wider IPS commissioning. So the KPIs included in MHEP, was perceived to align with both the previous contracts and employment support and the national IPS rollout, which means that there was a sense of familiarity, which definitely helped. What I do want to note, which I think is really important, is that while interviewees identified a variety of different facilitators, service providers only identified 2. And they could identify a wide range of barriers, and other interviewees identified a wide range of facilitators, but service providers could only identify 2. And we thought this was interesting. However, this may not be surprising given that the providers are largely shielded from the inner workings of the social impact bonds. Nevertheless, it could also mean they were the stakeholder that bore the brunt of the initial complexity of implementing a service funded through this new way of working. So this may suggest that they need to be more adequately supported through the initial learning curve of using a social impact bond mechanism. We hope that this finding can help other social impact bond projects, help with the setup and better sort of support these providers. In terms of the next slide, there were 3 main common barriers, and this was that the payment structures was perceived as complex and unfamiliar, that the cohort differences meant that users with the learning disability cohort required longer and more intensive support, and it also represented a fixed population which limited referrals. And thirdly, that COVID-19 has significantly affected project performance and outcomes. Now, in terms of the next slide, I'm just going to go deeper into this complexity point, because I think this complexity as a barrier to the social impact bond is really fascinating to me. So the SIBs were perceived as complex, but for two reasons. And the first is the complex in payment. So what does this mean? So it means that the splitting or the balancing between the outcome-based payments and the block payments was slightly unfamiliar to them. And secondly, through the design. So the design of the outcome metrics, which are the core of the social impact bonds. So under these MHEP projects, it's only possible to claim 1 payment for each job start, regardless of whether the participants are supported into multiple or separate jobs. So a second job start is not classified as a payable outcome, but it's actually covered under sustainment outcome. And that was an initial sort of confusion for these IPS providers. Now, in terms of the next slide, we know that social impact bonds, that payment by outcomes is a key feature. However, unlike other projects and unlike extreme payment by results contracts, MHEP payment arrangements blend both block and outcome payments. So this means that there's not a full exposure to non-payment in situations of poor performance. So the exact split of payment arrangements vary across the projects. So this range from 70 to 30 or 95 to 5. So what that means is sometimes it goes 30% outcome payments versus 5% outcome payments for some of these social impact bonds. What was also good to note is that blending funding from the Life Chances Fund and the local commissioner, as well as the splitting the outcome-based payments and the block payments, meant that the payment flows were unfamiliar to providers, and that the need to calculate bespoke payments depending on the outcome achievement, rather than just set levels every time. This added to the complexity of invoicing for MHEP. So having to calculate and really be mindful of the payments that were really just only for the outcomes achieved adds to this complexity, as we all know. Now, turn to the next slide. So what is the point? So basically, the MHEP interviewees said that a healthy amount of pressure was described as ideal to manage this financial risk easier and take on more contracts, because as we all know, people are slightly more risk adverse. And what we found is that several MHEP team members and providers stated that this ideal, this preference, was this 95% block and 5% outcomes. And this was perceived to generate sufficient incentive for them. Now, in terms of the next slide, just a little bit more into the complexity about the factors. So when would there be a difference in discomfort at a higher outcome payment ratio? So we found that interviewees said that during a crisis in the pandemic, they would not be comfortable relying on a higher outcome-based payment. We also found that smaller providers, so there was a concern that if performance-based payments become more mainstream, that smaller third sector providers in the longer term may struggle, even if they may be more suited to deliver better outcomes for that area. We also found that providers with less reserves would feel slightly more uncomfortable with a higher ratio. And we also found that different roles within provider organizations. So providers that were more in senior management roles definitely preferred a higher outcome-based payment because it's clearer for defining outcomes and it's really clear on what to measure. In terms of the next slide, what did commissioners think of all this? So commissioners actually reflected quite positively on the payment arrangements, and it made them consider using outcome-based payments in their mix of the contracting options for future projects. So we have here one local commissioner. They stated the experience from having done outcome-based payment by results. I would look to adopt that model as part of the contracting financial mix. However, they would go back and they would firstly try and understand the probability of this model in delivering outcomes. They'd also want to recheck the likely success of integration for referral pathways and also its setting, because we know that this would influence the extent, success. And these three factors would influence majorly his probability of loading payments against outcomes in his future commissioning contracts. Now, I'll just briefly run through the performance results on the next slide. So, for performance, early performance data finds that MHEP social impact bonds were performing below initial targets up to the period of December 2021. However, these targets were set prior to the pandemic. And we know through our analysis currently that the job outcomes and sustainment rates have improved quite radically since. What is interesting, that changes were made to support projects during this difficult sort of time and difficult performance in the pandemic, such as COVID-related activity payments. And I'm happy to talk about that further in the panel or questions. And the other major sort of performance finding was that among participants with severe mental illness, the job outcome rate, so this conversion rate, was 29%. So this is actually similar to the lower end of normal that's seen in IPS implementation literature, which is generally around 30% to 50%. Now, on the next slide, we can see sort of color-coded of the sort of success rates. So you can see from yellow and red, this does hint at underperformance, but these were initial high case scenarios, so ambitious targets set prior to the pandemic. And on the next slide, we can see the conversion rates. You can see the conversion rate slightly more green colored. The success rates were quite decent. And we can see that, from this, it's quite self-explanatory that 29% is on the lower end of normal in the IPS implementation literature, apologies. So on the next slide, just a quick summary of the performance. Overall analysis of the outcome rates, we find that quarterly performance appears to be below expectations, often around 50% of anticipated targets. Success rates in meeting job outcome targets have remained quite at a similar level over time. Job outcome rates at 29%, which is within normal. And with respect to outcome-based, composition, more than 65% of all achievements for the severe mental illness cohort was actually on engagements, which is an interesting finding. But the one thing I want you to take away is that performance against these targets is massively being affected by the COVID disruptions. Now, on my last slide here, I'm just going to briefly touch on why is this MHEP case study, or why is this MHEP evaluation, why it might be relevant for you and what you can take away from it. And we hope that you sort of stay tuned to us to other additional reports that are coming in due time. So firstly, the MHEP project, it is an example of how to scale and replicate impact bonds. So since 2015, since its conception, MHEP is this special purpose vehicle, 6 contracts under an additional outcome fund, which is a CBO and social outcome fund, as well as 5 contracts under the Life Chance Fund. All of them have very similar parameters in its contracts. So we found that the special purpose vehicles actually delivered quite cookie cutter-like approaches. And this is seen as quite convenient and reducing transaction costs and helps with institutional memory and it's just slightly more easier to roll out. And some providers, Twining and Working Well Trust, have worked under MHEP since its conception, which I think is an interesting observation. Secondly, MHEP is an example of how to scale up evidence-based interventions. And we're really curious of whether or not we can find, can social impact bonds be an effective contracting tool for evidence-based interventions? Thirdly, MHEP is an example of how low outcome-based payment ratios is existing and how this compares to historical extreme payment by results. And gives an example to people that might be struggling about how to set this ratio. And Sarah Bailey has some excellent understanding and insight on how MHEP has over time found that this sort of unique threshold has come about. Fourthly, the MHEP project, it tackles big questions in the social impact bond space, as Andrea said in the first part of this webinar. So it tackles value added. So can social impact bonds perform better than other contracting arrangements in terms of the social outcomes achieved, and do the benefits outweigh the cost? And we're super excited to answer this very, very shortly in our next reports. And lastly, MHEP is an example of investing in health and social care, which we think, I'm especially interested in. I hope everyone on this webinar is also especially interested in. And it shows an example of how to tackle healthier lives through social determinants of health, which we know is good paid employment. So I'm very fortunate to be evaluated on this project and work with amazing people, particularly those on our panel.